Congrats, you're pregnant. Have you searched pregnancy symptoms yet and convinced yourself you suddenly have every rare condition known to mankind? Yeah, pregnancy Google spirals are very real. In this video, I'm gonna guide you through your prenatal checklist, who to see to monitor your pregnancy, what tests they will most likely order, and who to bring with you to these appointments. Because trust me, you don't need every old wives' tale and internet myth messing with your head. Let's break it down properly. Hi, I'm Liz, a registered nurse, kinesiologist, and certified breastfeeding specialist. Here on the channel, we talk about all things baby from pregnancy to postpartum. If you want expert advice with a dose of real talk, hit that subscribe button and check out my newsletter for weekly pregnancy and postpartum tips. The link will be in the description. Let's get into the video. Your prenatal care with your healthcare provider is basically VIP access to making sure you and your baby are doing great. They are regular checkups, tests, and guidance from your professional who actually knows what they're talking about, so you don't have to rely on random internet forums. And let's be real, your aunt's advice about avoiding cold drinks so your baby won't get sick, not really a medical fact. So who's in charge of making sure your pregnancy goes smoothly? First of all, family doctors and nurse practitioners. They are highly trained in prenatal care and can follow you throughout your pregnancy. OBGYNs are the go-to for hospital birth and high-risk pregnancies. Midwives are more hands-on and deliver a more holistic approach. They're great for home births, birthing centers, and even hospital support. So what happens at these appointments? Your first visit is when you're about 8 to 11 weeks pregnant. Usually they do a health history, blood work, and probably an ultrasound to confirm the pregnancy. Basically, this is the get to know you phase of you and your healthcare provider. At the 12 to 30 weeks, you usually get a monthly checkup. Weight, blood pressure, baby's growth, and bonus points if you remember your last period when they ask. At 31 to 36 weeks, you usually get a follow-up every 2 to 3 weeks. At this point, they're checking your baby's position and heartbeat. At the 37 weeks up until birth, it's usually weekly visits. It's the final prep where they talk to you about labor and what to expect. And you don't have to go through all of this alone. There are pros who could actually help you with this. They're called doulas. Doulas offer emotional support before, during, and even after birth. There are also prenatal classes and services available online and in communities. Let's talk about that for a minute. Prenatal classes aren't just breathing exercises. You've got different options like yoga, aqua fitness, Pilates, and even classes where your partner can attend with you. They could know how to be more useful to you during labor. So if you want to make sure your partner knows the difference between comforting you and annoying you, sign them up for these classes as well. If you're planning on breastfeeding, the best time to take a breastfeeding class is while you're pregnant, a few weeks before delivery. This is because you want to be ready to breastfeed immediately after childbirth. And trust me, you're going to be way too tired to sit down and learn anything from a course when you do have a newborn baby. If you are looking for a breastfeeding course or class, I do have one that I offer myself. It will also be linked in the description below. Let's talk about the not so fun but super important part, tests your doctor might recommend. First is blood work. This is used to check for infections, your blood type, anemia, all kinds of other things. Another test they will do is ultrasound. This is to monitor the baby's growth and confirm the due date. They'll also do a glucose test. This is to test for gestational diabetes. All the tests are about checking the boxes and making sure that you and your baby are healthy and ready for what's to come next. You've got this. If you ever feel unsure, don't be afraid to ask for help. Pregnancy is a wild ride, but you're not in it alone. What's the weirdest part or funniest pregnancy advice you've ever gotten so far? Drop it in the comments below. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more expert-backed advice. I'll see you in the next one.